imagined. I think there are days when you can feel more of a muscle ache than others, and it can be age, it can be all sorts of other things.
Dr. Golomb makes a stunning accusation about why she believes some doctors in the US may push their patients to take statins.
I think they often intentionally hide those risks because there are often physician incentives that benefit the physician for having more patients on statins. So it pits physician self-interest against patient benefit. This particular woman contacted me, and she had left the practice that she was at because they insisted that at least, I believe it was 80% of her patients be on statins. This has actually been written up in media as something that is actually considered legal and acceptable. I can't see any way in which that's acceptable. I'm literally the only researcher I know who studies this class of drugs who has a policy not to take money from industry.
Statins are meant to be lifelong medications, but Dr. Curtis says we don't know about the long-term side effects.
The studies that have been done have generally been just a few years in duration. The long-term effects may not show up for many years. It may take many years for a cancer that develops to make itself manifest. Because cholesterol is so important in the brain, could it contribute to dementia when someone gets older if you lower their cholesterol? We don't know. Again, how would we be able to tie that to the drug? So all of these concerns about the unknown long-term side effects are very serious, in my opinion.
Harvard doctor John Abramson is an expert in litigation involving drug companies. He says we're not being told the whole truth about the dangers of these drugs.
We're told over and over again that statins are extremely safe. And when you look at the results of the clinical trials, you would conclude that they are safe. The problem is that the clinical trials are not designed to pick up all the side effects.
The CTT collaboration, for example, use mostly drug company data and report very low levels of muscle side effects from statins. But when you look at the side effects in the general population, it's 100 times higher.
Are the trials lying? No. I just don't think they asked the right questions. Why didn't they ask the right questions? It's not in the interest of the drug companies to ask the right questions. So it's creating the impression that the drugs are safe.
Another complication with clinical trials is that drug companies don't recruit volunteers that reflect the typical patient on statins.
The problem with the study design is that we exclude people with chronic disease or other comorbidities. We exclude people who are very old or very young, and we'll certainly exclude people with other types of risk factors or diseases that may interfere with the metabolism of the drug. So we often get a skewed picture of what the side effect profile is.
The fraction of people with problems in my sort of real world on multiple medications, et cetera, clinic is far higher. And I would say in that sample, it really seems on the order of a third of patients that develop problems.
There are a lot of ways that one can manipulate data in a trial. Trials do what they call a washout period. And what that means is before they choose the people that are going to be in the trial, they give everybody the drug, and the people that have side effects get excluded from the trial. And they say that so people aren't uncomfortable when they're in the trial. But of course, it takes out all the people that have side effects, and that's very commonly done in drug trials.
So the side effects would be grossly underestimated?
Yes, it would definitely grossly underestimate the number of people that have side effects. They're not as safe as they've made out to be, no.
In its effect, it's certainly scientific fraud, and in its effect, it's organized crime. It's always difficult to allege intent, but it is clear that manipulation of evidence subjects many people to treatments that those people should never have been subjected to.
I think there is criminal activity that goes on. And I think when drug companies act in ways that misrepresent information, that leads to harm, they ought to be held responsible, just like any other individual or organization that conducts itself in a way that leads to harming other people.
drug companies have a history of illegal activity. This is just a sample of the billions of dollars in fines they incur for things like fraud and bribery in any given year. In the 80s, when President Reagan came into office and slashed funding to the National Institutes of Health, it left a gaping hole for private industry to move in. Nowadays, around 85% of trials are funded by drug companies. A review concluded that if a drug company paid for a trial, it was 24% more likely to report the drug was effective, and 87% less likely to report the drug's side effects.
There's a sense that science is science, so it doesn't matter who pays for it. And yet, because the research is privatized, the fundamental purpose for which it's conducted has changed. It's not to improve the public's health, it's to fulfill the fiduciary obligations of the sponsors and create an opportunity to maximize profits instead of improve the public's health.
Some might say that that's a rather cynical view of how science works.
To say it's cynical that commercial sponsorship of science taints the science is just totally naive. It's silly. Business is in business. Their job is to make money. We ought to be clear in our public discourse that to say we've got a bias in commercially sponsored research is neither cynical nor paranoid nor impolite. It's a fact. So let's just accept it as a fact and stop being naive at our own expense.
But if Big Pharma doesn't pay, it will have to be the taxpayer.
A drug now costs about $2 billion to develop. The success rate of drugs is very low. You know, is the public purse going to be willing to shell out in advance for $2 billion for a drug which it doesn't know the likely outcome of?
Arguably, the biggest ethical issue in science is that drug companies withhold unflattering results. So in the end, what we're presented with is a distortion of the data.
2 of the 3 major drug companies declined to comment. AstraZeneca denied these allegations, stating that all their trials are publicly available. But in 2010, the drug maker reportedly paid $500 million to settle a class action after being accused of burying information about the increased risk of diabetes seen with their widely prescribed antipsychotic drug, Seroquel.
I spend a lot of time as an expert in pharmaceutical litigation. And one thing you learn is that you can't possibly know what's going on with that drug unless you have access to the corporate hard drives. If you want to know the truth about a drug, you need to have subpoena power or in litigation discovery that gets you into those corporate hard drives, because without getting into the corporate hard drives, it's impossible to know what the real benefits and the real risks of those drugs are.
Even the definition of high cholesterol keeps changing. In 2004, a US panel of experts decided to lower the threshold of cholesterol, which sparked outrage among many doctors.
More and more people think they have high cholesterol, even though they don't have high cholesterol.
By changing the definition, it meant that millions more people became eligible for statins, and these thresholds were adopted by many countries around the world.
Has this been on the basis of any scientific data? Absolutely not. Absolutely not. No evidence whatsoever. Just the theory that less is better. You're creating more patients. You're creating more people who now have something to worry about where they didn't have anything before.
But Dr. Sullivan insists this was a good decision.
I think what we actually started off with was maybe appropriately conservative targets, which were really not in the patient's best interest. So the likely outcome is a further reduction in targets.
More cholesterol lowering.
Yep, I think that's absolutely to be expected.
The decision to lower the threshold of cholesterol was a controversial one. An investigation into the matter revealed 8 out of 9 panel members had a direct conflict of interest after declaring financial ties to the companies that manufactured statins.
We don't have independent reviewers evaluating the data and making independent recommendations. You might ask, am I accusing these people of selling their opinion because they're getting paid by the drug companies? No, I'm not. I'm not accusing anybody of bad faith. But the people the drug companies choose to pay are people who advocate the use of their drugs and have standing and presence and reputation that will enhance the sales of their drugs.
So do drug companies seek out doctors to be their mouthpieces?
Drug companies clearly seek out what's called key opinion leaders. These are people with a national reputation who can create the street knowledge for practicing physicians that this is the way things should be done.
There is ample published literature showing that doctors who receive money from drug companies have more favourable attitudes and prescribing habits towards that drug.
There's no question that doctors are influenced by drug companies. I hate to say it, but drug reps showing up in nice suits and fancy women's clothes without much medical education play a significant role in what doctors think. Now, there's no reason for doctors to be getting their information from drug reps. My goodness, the drug rep's job is to increase the sales of the drugs they represent. Doctors need to take some responsibility. They need to do their best to get independent knowledge, and they need to put political pressure on their governments to get the clinical trial data unsealed so they can know what the clinical trials really showed.
Many doctors feel obliged to follow the guidelines, even if they don't agree with them.
They have to worry about malpractice suits if they don't follow the guidelines. An opposing attorney could make them look very bad in court by saying, well, doctor, do you think you're smarter than this national group of recognized experts? And this is a factor that's impelling doctors to follow the guidelines.
The push to lower cholesterol in the wider population continues. A group of doctors published an article claiming that statins could counter the effects of eating a burger. They suggested that statins be handed out as free condiments, just like ketchup.
Because it gives people that false reassurance that it's okay if you eat this food that is not good for your health, because then you're going to take this pill that's going to make it okay. And that's very attractive, but it is a fallacy. It's just not true, and it's still bad for your health to eat processed foods, eat trans fats, and have a regular diet of fast food hamburgers.
And the absurdity doesn't stop there. Here in the US, it was even suggested that statins be put in the public water supply.
I think this idea of handing out statins willy-nilly to everybody is totally irresponsible. You're talking about a drug with potentially toxic side effects, and a drug whose, quote, beneficial effect is extremely small and whose benefit can be achieved with much less toxic drugs and even with some non-drug treatments.
We're missing the message that health rarely comes out of a bottle. Exercise and a Mediterranean-style diet is the best way to prevent heart disease. I think virtually everybody agrees with that. Now, it's very clear that when you look at the effects of exercise, they're far more powerful than statins. Moderate exercise, exercising the equivalent of 2 hours of brisk walking a week, adds about 2 years to your life compared to not exercising that much. 2 years. Now, for statins for low-risk people, no benefit in longevity. So do you want to exercise, which is going to add 2 years to your life, or do you want to take a pill that's not going to lengthen your life and has the risk of side effects? It's craziness.
Until the science of clinical trials can break free from commercial interest, then decisions about our health rest in the hands of big business.
The views expressed in this episode of Catalyst are not intended as medical advice. Please consult with your doctor regarding your medications.